Hello, everyone, and welcome to another podcast for the Healthy Dog Workshop. Today, my guest is the awesome integrative veterinary oncologist, Dr. Kendra Pope, who coincidentally, and hi, Debbie, you popped on there fast, coincidentally is vacationing for the weekend very near my hometown. So it is a small world out there, Dr. Pope, isn't it?
Oh my gosh, it's so tiny.
It's so tiny. And I grew up, for those of you that don't know, in Nowheresville in the Catskills. And nobody goes there. Dr. Pope. So thank you so much for taking some time out of your long weekend. And thanks, everybody is jumping on. This is like record time, guys. Hi, Janet. So let's dive right in. You are an integrative veterinary oncologist. Can you tell me what that entails? Because I think a lot of people don't understand what you do and how it's different from your conventional oncologist.
I would love to. So, the easiest example that I like to use for my pet parents is to think of cancer as a weed. And so, as a conventional oncologist, what we do is we cut, burn, and poison the weed, right? Our attention is on the weed, is on the cancer. And the tools that we use is to destroy and to eliminate the weed. But what we forget about in that approach to cancer and to, frankly, any disease is the soil that weed grew in, that body that the cancer is forming in, and that is driving the weed to begin with. And that if the soil was healthier, the weed couldn't grow in the first place. And even if you cut, burn, or poison that weed out, if you don't correct the imbalances in that soil, that weed is going to come back. So, what I do as an integrative oncologist is I focus in the soil. I'm the gardener. And oftentimes, your approach to the weed can completely change, maybe be less aggressive, or maybe prevent it from ever coming back if you're
Mm.
able to correct all of those imbalances. So it's all about shifting your focus away from just the tumor to the entire body and that soil that weed is growing in.
That makes so much sense, and it's so much more proactive than the reactionary. Okay, let's blast the patient with chemo. Let's take them to surgery or use radiation. What kind of tools are some of your favorites that you use in your cases?
Yeah. There's many different ones that you can reach for depending on your goals, because some cancers can be very aggressive and they can carry really short prognoses. Other cancers can kind of be slow burners, and even with conventional treatment can have prognoses of a long time. So the different tools will be based on kind of our goals of treatment. But there are these kind of foundational, tools in my toolbox that I'm always reaching for. So for sure, diet is always our foundation of what we're starting with.
Mhm.
For sure, supplements, because you're not going to be developing cancer if your soil is not missing nutrients, not missing, certain supplements, not having inflammation. So definitely diet, definitely supplements. And then there's oftentimes lots of other specific herbs that have that anti-cancer, anti-inflammatory, immune supporting activity. So we're always looking at combinations of usually supplements, nutrients, and then dietary changes. Those are like the foundation of everything.
That's your core. Well, and
Yeah.
you provided such amazing advice for my own dog who's battling some kidney disease. And I remember you started off with a Western herb and a Chinese herb. And I remember calling you like 2 days into it and saying, he's not drinking buckets of water anymore. He's not peeing on my kitchen floor. And you
Mm-hmm.
laughed at me
Mm-hmm.
because we're friends. And you said, yeah, it kicks in that fast. And I think people expect that with conventional medicine, that, yeah, you take that pill and you feel better. But I didn't expect it with herbs, but obviously it happened to me. And
Yeah.
is that a typical thing or only with certain herbs or treatments? Do you
I
get
think
immediate
that it
response?
it is typical to see responses quickly. I think where it can be confusing for owners and sometimes we can get off track with treatment is when we've been doing a protocol for so long that we forget how good we're doing. Because although they can work quickly, their full effects take long periods of time. So usually months. And
Mhm.
so it can be challenging when when we make changes so slowly to be like, "Oh wow, look how far we've come over the last 3 months." And owners can stop doing the protocol and then slowly they go back to where they are. So because they're slow acting for their full effects, we sometimes can stop and then be like, "Oh crap, stuff starts to come back months later and it takes us, time to get back on track."
Mhm.
But that's what's so nice about natural approaches versus synthetic and pharmaceuticals is that because it's not just one active ingredient, because it's not just one thing that we're doing, these plants have so many actions that we're hitting all of these targets. So it's always beneficial for multiple things.
That's really cool. And, I
Yeah.
think we forget that, just because we're talking about cancer today, that doing these things, help my dog with kidney disease, helps dogs that really aren't sick yet, um, helps them live a better life, takes down inflammation in the body.
Yep.
Oh, and by the way, guys, if you guys want to post a question in the comment section, we'll see if we can answer it. Obviously, we can't answer questions that start with my dog because we can't give advice, but we can give information and educational type things.
Yep.
Um, so, I've known you now, God, 7 years.
Yeah.
Seems like
Yeah.
forever,
Yeah.
forever.
Yep.
And you built a thriving practice that is based in New Jersey, and you've got an associate, you've got an amazing team. And now you're kind of branching out more into your education era.
Yep.
So you've developed this cancer course,
Yep.
or cancer prevention course is
Yep.
where it's geared. What was your inspiration for that? Or was it born of frustration with something?
Yeah. So in going through the cancer treatment process with so many pet parents, the natural question that we would always come to either once the journey with cancer with their pet came to an end, or they found themselves questioning the health of their other pets, or ultimately getting a new four-legged family member, was how do I prevent this from ever happening in the
Mm.
future? And I found out really early that all of the things that I was doing to treat cancer also work in the prevention setting, just when they're tweaked and modified in different ways. And so it's one of the most commonly requested questions. But the other thing that is most important about cancer that I don't think is emphasized enough, not just in the veterinary space, but also in the human space, is the only cure for cancer is prevention. And
Wow.
so,
Wow.
although we have been made to believe that if we continue to invest money into treatment and we invest money into research, that there's going to be a cure for cancer. But if you really look at the statistics about how far we have come since the war on cancer started in 1971, where we've dumped tons of money into cancer research, the only improvements in mortality that we've made, which has been about 30%, have come from prevention.
Wow.
Getting rid of cigarette smoking, knowing that it causes lung cancer, identifying prostate cancer very early with a PSA test. So the mortality rate improvements in cancer have come from prevention strategies, not from treatment strategies. And so we're made to believe that by continuing to invest energy, resources, and money into cancer, we're going to find a cure. We already have the cure. It's to prevent it from ever happening. And so my goal is to make that messaging more public, more known, and to, along with that messaging, to help people to understand that 90 to 95% of cancers are preventable with lifestyle modifications. because they're environmental, they're not genetic. And so you have control of these factors. And so if you take control of these factors early, you could potentially change that outcome. And that's not a message that I even understood as an oncologist
Wow.
until I was already practicing oncology and started learning about functional medicine and natural medicine, because that's not what we're conventionally taught. We're all conventional medicine is disease focused.
Mhm.
So it's about expanding the understanding of how much power we have in that time prior to the disease happening.
Wow, that is an amazing soapbox.
Yeah.
Um, and I think in the pet world, I mean, I think of golden retrievers, and
Yeah.
everybody says golden retrievers have the highest rate of cancers because they're inbred, and they look towards a genetic reason. Now, there certainly could be because it is a breed and the gene pool
Yeah.
is it, but the gene pool is pretty big. You know, as someone who's involved with different dog breeds, it's not like we're talking about, you know, Polish lowland sheepdogs where there are only 100 in the United States.
Wow. Yeah.
Um, but the importance of environment, and what do we
Yeah.
do with our dogs but pollute their bodies from the
Yep.
outside in?
Yep.
Um, that's just incredible. I can see the T-shirts now. Pets Academy. Prevention is the cure.
Yeah. Exactly. It totally is.
Exactly.
Mhm.
So obviously, that's something that you want your students to really take to heart.
Exactly. Yeah. And, the thing about cancer education and cancer prevention education is this is a disease that we know affects all of our family members, right? There's
Mhm.
rapidly increasing rates in people, rapidly increasing rates in our dogs and our cats and our companion animals. This is something that, with the modern age and all of those things that we've changed in our society to, make more profits, to live life faster, to make life easier, that all are affecting all of us. And so, although obviously I'm a veterinarian, my patients are animals, this program is directed to the pet parent. The really cool thing about everything that you learn is that it's translational.
Yeah.
So, what generates cancer in a four-legged animal generates cancer in a two-legged animal, and vice versa. There are obviously subtle nuances, and, certain breeds are predisposed to certain cancers, just like certain humans, depending on your race and your background, you're disposed to certain
Mhm.
cancers. But those general factors that we know that drive cancers, they're the same for all of us. So in learning this information, you're going to gain information that you can apply for yourself and your family, because all of us deserve to understand the control we have over all of our lives.
Yeah.
Hmm.
Janet has an interesting comment, and I'd love your thoughts here. Um, Janet is one of my Healthy Dog Expo team members and lives way north of me. Um, but and I fight this in the exam room, getting people to invest or buy into the importance of fresh food.
Yeah.
And it is so convenient to dump that kibble in the bowl.
Yeah.
Um, how do you approach it with, say, a new person, or how will you address it in the course?
Yeah. So I think that it can sometimes, the most important factor when I'm having that one-on-one conversation with an owner is to figure out where their block is. Is it a block on them believing that it's bad? Is it a block that they don't have the time? Is it a block that they don't have the money? And trying to figure out where that resistance is coming from.
Mhm.
But what I try to do when I feel like my wheelhouse, my comfort, what I enjoy doing the most is educating and sharing information. And so what I do a lot of is just explaining to owners why it is that these commercially prepared foods are so bad. And so most people think, that it's because, oh, there's roadkill in the food, or they think of those really low quality dog foods that
Mhm.
do have really horrible things in them. They don't understand that even if it's a completely high quality diet that they're paying premium pricing for, that claims all the best ingredients, it's not just about what's going into the food, it is how the food is processed.
Mhm.
And most people don't understand that the higher heat, the food is exposed to, and the more times a food is heated, the more that there are these inflammatory byproducts called advanced glycation end products, which a lot of our colleagues online have done an amazing job of starting to educate people, are more aware of these inflammatory components in them. But there are studies that are done that show a dog that eats commercial diet is exposed to 100 times higher the amount of these byproducts
Mhm.
than humans are on a daily basis. And what they do is essentially just drive oxidative free radicals in the body all the time in advanced aging. So basically, you're just scooping in years lost of life every time
Mhm.
you do that.
And put a price on that, whether you're measuring price in dollars or the human's time.
Mm-hmm.
And
Mm-hmm.
that doesn't even account for the veterinary cost of doing that. And I had a client ask me, how often does my dog get ear infections? Well, gee, I don't remember.
Yeah,
You
because
know,
it doesn't happen.
it doesn't happen because my dogs are from generations of fresh food fed dogs.
Yes.
And, those kind of things, I don't even think about treating my own dogs generally at home unless it's an injury or, something crazy comes from left field.
Exactly.
Um, so, you know, I feel like you're diving into some deep science. What is the science level of the course?
Yeah.
You know,
So
can somebody who really doesn't have any formal training or was an English major in college, you know
yeah. Yeah. That's a good question because I do, if anybody has, followed any of my pages or watched any of my lectures, I love the research because I think that it's very important that um in empowering not just my colleagues but my pet parents to have higher level conversations with either conventional veterinarians that may not agree with them or other people that don't agree with them, that they have the information to be able to refer to for those people. But as far as the level that is needed to participate in the course, it's 1,000% available for lay people. There is going to be a lot of resources for people to go deeper, so that if you are maybe someone who is science inclined, or you like to read scientific literature, or you would like to educate yourself further, I will be linking references as well as having resources so people can do that. But there is absolutely no reason that the average person can't take the course. And the whole goal is to be able to have it be at that level, to just be an introduction. I do know that some veterinarians have signed up for the course, and I think that
Oh,
that's still
cool.
appropriate too, because it's just like a little like eye opener, right? Like it's just to really put that information out there to be like, look, this isn't just my opinion. This is fact. This is based in science. This is based in studies. This isn't just what my experience and anecdote has taught me. So there will be rabbit holes for people to go down, but
Mhm.
as a general person just interested in learning more, you will be completely fine to do that.
That's awesome that vets are signing up
Yeah,
because
it is.
it's and I just dropped the link to the webinar, I think, in there. I'll drop it again. Uh, because this is information that's not in the veterinary mainstream.
Yep.
And it needs to be the balance of science with an understandable message.
Yep.
Um, I'm looking at Apple the Golden's question, which we should be able to. Um, I was thinking of glyphosate as you were talking about kibble.
Yeah. Yeah.
That's the active ingredient in Roundup,
Yep.
and has been linked to mostly bladder cancers in humans. Is that correct?
Bladder cancers and lymphoma.
And lymphoma.
Yeah.
And um, what's your take? And will you be talking about glyphosate in the course?
Oh my gosh, yeah, totally talking about glyphosate,
Good.
and also empowering pet parents to order the diagnostic test if they would like to and run the levels in their own dogs, and then help them to, or cats, and help them to determine what the level means and then what to do about it. We routinely check glyphosate levels in all of our patients, and they when I first started doing it, I expected them to be higher. Some patients actually do pretty well. But we have had some patients that have alarmingly high levels of glyphosate. And it's interesting because it's not always correlated to the pets that you would think would have really high levels. And that
Mhm.
speaks to the body's ability to detoxify. Just like humans, some pets are better at getting rid of it and some pets are not as good at getting rid of it. But yeah, pet parents will always say to me, "Oh, wow, we don't spray our lawn or we don't live on a golf course." Most people don't understand that the primary way that pets get exposed to glyphosate is from the commercially available dog foods. And
Mhm.
it's because glyphosate and weed killers and pesticides, along with our crops that are most heavily used in pet food, things like corn, soy, and our, legumes, are heavily sprayed with these types of pesticides to allow them to grow larger, be cheaper, make more money. And so they're intertwined with one another. And so most of these commercially available and prepared foods have glyphosate in them because of um, the carbohydrate sources that are
The
being used.
process, the whole process.
Hmm. Yeah.
Um, yeah, and it is, I'm glad you mentioned enabling people and empowering people to do testing on their own. I know you'll have several tests where
Yeah.
you've worked with companies and you'll be able to help people. Maybe they'll need a urine sample, maybe they'll need a
Yep.
blood sample from their vet,
Yep.
but where they can do this testing on their own
Yep.
and then take it to their vet and share that information and make an action plan.
Yep, exactly. Yeah, the whole point of the program is that owners will be able to assess the health of their pet individually by themselves and to get a really clear idea of the areas they need to focus. But not all pets are, just slightly down the stream of health where they just need a little help to get back up. Some of them are really far at the end
Mhm.
and you may not even be aware of that. So in those instances, we may need to get a veterinarian involved to help us, but at least you'll have a really clear idea of what areas of focus you need to kind of identify, because so much of this looking under the hood and evaluating the soil is not able to be done with conventional diagnostics. They
Right.
don't evaluate that. And so your pet could be completely healthy in the eyes of your conventional veterinarian, and there could be all this simmering, concerns underneath the surface that we don't know about.
Yeah, yeah. And many conventional vets don't even know, for example, that you and I both use VDI labs a lot for
Yep.
vitamin D and other markers. They
Yep.
don't even know VDI exists.
Right, right, and
Um,
don't know what to do with the
what to
results
do
or
with
the
it,
answers.
or
Even, a lot of my patients have boarded nutritionists that they work with. A lot of the nutritionists get super freaked out about the vitamin D levels I have my patients on because it's, above their standard. But
mhm,
that's because our standards aren't set to serum levels.
right,
We're treating patients based on their actual serum deficiencies, not on a standard. These patients aren't optimal and healthy. So it can be, even when we do have people that are aware of what to do with this information, that's only based on healthy animals, not unhealthy animals.
yeah. And of course, the standards that nutritionists use, in some cases, there are no maximums.
Yeah.
And they all want to throw in a synthetic vitamin mineral premix, which is not tailored to specifically what protein, carb, fat levels are in the diet.
Yep.
My third thing against nutritionists, since why not? They all want to use Balance It. Guys, Balance It, in my opinion, is not a good tool to use. It is not based in any sort of nutrition knowledge. It's kind of like the old Chinese menus where you picked one from column A, one from column B, one from column C. And you can make a nutritionally complete spaghetti and meatballs dinner for your dog. I know because I did it. Um, and it was literally spaghetti, tomato sauce, meatballs, and their vitamin mineral supplement. Oh, I think you had to add a little canola oil. True. So yeah, you're taking the high road. You're taking the high road. So anyway,
Uh,
we digress just a bit.
yes.
I know we're eating up a lot of your time.
That's
Um,
okay.
so I mean, I just see from talking to you the value of the course. And I was looking through the different modules, and it looks like you have a truckload of content.
Yeah.
So you're gonna give people like a module per week for 8 weeks?
Yep. They get a module per week for 8 weeks. So, the education, right? That's great. But sometimes people are like, look, yeah, I want the information, but for me, I want to know, what is it going to get me? What is going to
Mhm.
happen when I take this course? What other than just giving me more information will this be helpful? And so I think the other parts that are really important to point out about the course is, yes, you will be getting a lot of information for sure. I promise you the amount of content that I will deliver will be probably more than you're looking for, because I just love
Yeah.
sharing all this information, and I want everybody to have everything I think that they should have to empower themselves. But the other part of the program that I think is most kind of actionable to get you results now and to help you now with a problem that you may not even realize you have now are a couple of things. One is that the course provides you with a scorecard. Basically, I allow you to assess your pet's life right now, or pets, however many you have in the household that you want to do. Assess
Right.
them right now and get a number, so that we kind of know, where are they down that river of health and how far away are they from optimal health. So you can identify where they are and which categories need to be fixed. That's something that I think will be really eye opening for people, because I don't think that they will guess correctly and find out which categories are right and wrong. The other thing that it's going to get you is, we have live calls as part of the course. So while you're working through it, questions are coming up. Maybe you're having little challenges in implementing some of the things in your
Mhm.
own life, or having questions, direct access for us to talk about as a group, get answers to those questions, and me really help you to institute some of those changes. That's the other thing. And then the other one that is really important to think about, you kind of alluded to this in the beginning, Lori,
Mhm.
in preventing cancer and in instituting a treatment plan that prevents cancer, you're preventing all chronic disease. All chronic disease is driven by the same thing: inflammation, immune system dysfunction, toxin exposure, poor detoxification pathways. You're going to be improving all of those aspects of your pet's life, which are then inherently going to prevent other chronic diseases like osteoarthritis,
Mhm.
allergies, GI issues, which, that converts to lots of things: happier life, more energy, less veterinary visits. So, although, yes, all of us want to prevent the big C, right? Because that's what we
Mhm.
know most of us worry about. It's also going to have all these other downstream effects, just to a general longevity and health span improvement, which, like, hello, it's like a win win win, right? So it's all of these things that come from it.
Yeah. And I mean, I'm glad you're kind of dripping the course out week by week, because I know people will want to skip to the end,
Yeah,
and
exactly.
and you go into overwhelm, because
Exactly.
as I was looking through and you said 1 to 3 hours a week would be the time investment. I was
Yeah.
like, I'd be spending 3 hours a week.
Yeah.
And it's like it becomes like 30 hours, like a full work
Yeah.
week of education,
Yep.
which is mind-boggling. Pat had a question. So obviously, we can't give advice on a specific patient that we haven't examined.
Yep.
But will you be able to have some like rule of thumb assessment hacks?
Yeah, 1,000%. So it's going to be, instead of me being able to say, like, in your, dog named whatever who has this disease, I would suggest as their doctor this, it would be, in this situation, if this happens, this would be the options that you could pursue based on these things. So, taking the diagnostics tests, telling you why they're important, and then telling you what the results would be, what the suggested treatment is. But part of the reason that I think that the scorecard is going to be so important is because, if you're a pet parent that has the energy and the resources to do everything, then do everything. But I think that one of the biggest challenges for most people in the amazing content that we can already access, free online, is that it is just general, and it can become overwhelming, because then you end up putting your pet on 30 supplements. You're not
Oh
sure
yeah.
which are helping. They're all kind of overlaying. You get burnout as an owner, because you're like, oh my God, how many pills today? They get burnout because they don't want all of that. So this kind of allows you to jump around. Like, all right, I'm going to focus on detox for the next 3 months. Then I'm going to focus on digestion for the next 3 months, and pick categories to really dive deep in, and, know what your goals are. Because I think that that's the other thing when I counsel a lot of pet parents that come to me that have access to, our colleagues, is they're doing amazing things, but it's too much and it's redundant. And so we want to be able to help everybody get a little bit more focused so that A, we're spending less time, B, we're spending less money, and C, we know what we're doing is actually helping the pet that we have in front of us.
Yeah. I've
Yeah.
had people come in with a shopping tote full of
Yep.
supplements.
Yep.
They're doing all these things. They don't know what's working, what's not,
Exactly.
anything
Exactly.
like that. Um, so that will be really helpful. And of course, I'm thinking of the cancer detection, early detection tests,
Yes.
vitamin D, of course, perhaps some hair tissue mineral analysis.
Yep.
There's so many options.
There's so many things that can be done, and the really cool part is that all of those companies are direct to consumer.
Yeah.
Even the company that you need the blood test for, they'll still sell you the test kit direct to you.
Sure.
You'll just need a veterinarian who's willing to participate. So and that's the way human medicine is going. They're making all of these diagnostics available
Mhm.
direct to consumers. We're demanding it, right? That's why it's happening. The patients are demanding that they know what is going on in their own bodies. It's
Mhm.
happening for the animals. So you're going to be able to get a lot of information and frankly understand more about it than even a lot of my colleagues do.
Definitely.
Hmm.
And they're going to have all the materials for life. This
Oh,
isn't
yeah.
like 8 weeks and it goes away.
Exactly. Lifetime access to all of the PDFs,
So,
lifetime access to all of the videos, so that, like, let's say that you watch the course and you like institute a treatment plan. And then 3 months later, you're like, what was that she was talking about this lecture?
mhm,
You go back, you watch it again. So it never goes away. You'll be able to watch
I
it
love it.
indefinitely. And, there will very likely be upgrades in the course as time goes
Mhm,
on. And so anything that changes will be made available to you guys. If there's like significant changes and there's a whole brand new course, that might be something separate. But upgrades to the content, stuff like that will be made
yeah,
available to people.
yeah.
Hmm.
And Janet asked, will you be offering the vet version of this course again in the future?
Yeah, so the veterinary version of this course is more of like a real intensive 9-month program where we meet 1 to 2 times a month, along with they have like hours more of content, and it's like
Yeah,
really, really science and deep and lots of conversation, and I have guest speakers. So that's something that happens every year. So we're just finishing our first group now. So the next group will start in the fall. Yep.
yeah. And of course, then there'll be a network of veterinarians out there because
Yes.
it might have been Pat was asking about not having a holistic vet to work with, and the
Yes.
conventional vet is very entrenched in their view.
Yes.
So you're building what we need.
Yes. And, you know, uh, some of these veterinarians do telemedicine, so you might be
Mhm,
able to access them completely remotely, which is really nice. But you'll know that all of these veterinarians have trained in the way that I have, trained them so that they
yeah,
can evaluate all of these diagnostics. They kind of know that lens to look through. So yeah, so for
yeah.
sure. Hmm.
And I'm just dropping the video link in here again, and that links to the webinar that you did
Yep.
and to the actual course page where you can read all the details and stuff. So, guys, if you're asking for more detail about the course, just watch that video and hit up those pages.
Yeah, yeah. The webinar gives you my kind of three biggest myths I think exist about pet cancer, and I bust them for you, and
Mm,
just some additional information on the next steps that you can take to prevent pet cancer.
yeah.
Hmm.
Um, so, yeah, anything else that they need to know about the course? Oh,
Good
the
question.
when it starts and the deadline to sign up.
Yeah, I was just going to say time. So, a week from today is the last day that the course will be available for a whole year. We're not going to offer it again until 2025. And that's so that there's time for me to be a part of it and to answer your questions and for me to be the one that's assisting you. So, this is the last time until 2025 that you guys can enroll. So, Sunday, June 2nd is the last day that the course will be available. And then, as far as when it starts, the actually June 3rd, the intro week will start where we kind of introduce everybody to the memberships that you'll be working on, how to use
Mhm.
the course, all those types of things. And then June 7th, material will start. So it'll run June and July. And then at the end of July, we'll have our final call. Actually, August, we'll have our final call, talk about everything, and then send everybody out in the world with all that new amazing information.
That sounds awesome.
Yeah.
Sounds totally awesome.
Thank you.
So guys, thank you. We're going to let Dr. Pope go on the rest of her vacation weekends
I
because
know.
you are going
Beautiful.
to be busy uh,
Yeah.
over the
Yeah.
next 8 weeks.
We got a
So
lot of amazing stuff to do, and I would love for
definitely.
all my pet parents to come join because I think it's gonna really, hopefully be transformational for you and your pet.
Well, there's nothing out there like this.
Hmm.
And I mean, I know there are a lot of people offering, for example, raw feeding courses and stuff.
Yep.
And some seem great, some I don't know, but nobody's putting this much science and this much, what would I say, new thinking out there.
Yeah.
So yeah, this is going to be groundbreaking.
Awesome. I think so.
So, I wouldn't be sitting here on my long weekend either if I didn't think.
Yeah.
So
Yeah.
guys, take a break, go to get your beverage. Inside Scoop starts at 12. Rumor has it that Dr. Robert Silver will be on talking about mushrooms. So get your mushroom fix on,
Yep.
and we'll see you later. Take care,
Awesome.
everybody.
Bye, guys.